The COVID-19 pandemic has highlighted the spike in sexual gender-based violence cases in Nakuru County and the country at large. During the Kongoni Police Station Sexual Gender-Based Violence Unit launch in Naivasha on 22nd July 2021, Nakuru County Police Commander Beatrice Kiraguri reported that in the last 5 months alone, more than 60 sexual assault cases have been reported in Nakuru East, Kuresoi North and Gilgil sub-counties.
The leading sub-counties, tuko na sub-county kama Nakuru East, it has 27. You can imagine 27 kids being defied from January to now. We have Kuresoi North having 26, and we have Gilgil 27. Others were on 18, like Rongai, Moro has 15. Hii data ni bebeba ndio uweze kuona kuwa ni kweli tunahitaji such facilities even into other sub-counties.
The Kongoni Sexual Gender-Based Violence Unit launch was marked with pomp and color as entertainers welcomed the distinguished guests and stakeholders who graced the event. The guest of honor, Judy Lamet, who is the Assistant Inspector General of Police and Director Community Policing, Gender and Child Protection Unit, urged police officers to safeguard the dignity of SGBV victims by being more sensitive when handling sexual assault cases.
So hii GBV inafanyika kwa siri, inafanya wale ambao wameathirika kukuwa na shida sana, kwa sababu shida yao nyingi ni psychological trauma. Haitangaziki ya kuwa kitu kimemfanyikia, lakini yeye mwenyewe ni mtu ana shida sana. Ni kitu ambacho kina touch the secrets. You know, it's something that touches on your intimate personality, that you feel you have been defiled, bad things have been done to you. So lazima naongea sasa hii kwa niaba ya polisi. Ukiona mtu amekuja kuripoti kitu kama hicho, hakikisha mumempatia dignity yake by listening and empathizing with that person. Msikize na umsaidie vile inawezekana. Tayari yako traumatized, usimpatie trauma ingine.
It was further noted that police officers lack the space, resources and expertise to handle GBV cases. At the same time, most police stations in Nakuru County do not have functional gender desks.
They don't have that space, they don't have that resources. Even here I was asking who will be in charge of this gender. I'm being told there's one madam who is sick and the new operation, meaning that there is nobody who has been trained to do this. So we have shortages here, training. How officers wanahitaji training so that we are able to handle hizo cases professionally na vile inahitajika.
According to the County Criminal Investigation Officer, there has been a lot of interference of investigations that derail the pursuit of justice due to lack of enough evidence.
We have faced very many challenges when investigating these cases. Sana tunapata interference kutoka kwa wazazi na wahusika ambao wanataka kubroker cases za victims ambao ni underage. Wewe huku najiziwa, hata hujui kunajiziwa ni nini. You don't know how that victim is feeling. Wajia sheria ichukue mkondo wako. When investigating, wachana na mambo ya compromise. Gather the necessary evidence ambayo inahitajika. Na sexual cases, we have time is of the essence. Once the report has reached you, ensure that all the basics are done. Let us give our people the necessary support that is required.
Human rights defenders in Nakuru County believe that lack of a common data sharing tool within gender stakeholders in the county has made it extremely difficult to deal with the rising GBV phenomenon in the county.
I think the greatest barrier that impedes our work is the fact that there is no that support from government, because you are able to report issues, maybe issues of violence, you assist the community in reporting, but then again when it comes to handling the matter seriously, it becomes a problem. And also the fact that there is no data, there is no one, we can say that if I want data that is able to speak to many issues, that maybe a central way we can able to access data. This is actually something that is a barrier to our work, because when you report a case, it needs to be handled by many players, from the hospital to the police to the courts to eventually to the courts. But if you don't have that mechanism that bring all these players together and having one place you can access data, make our work very challenging.
With the formation of the gender clusters in the 11 sub-counties in Nakuru County, the county's Department of Gender, Culture and Youth Affairs believe there is hope and a brighter day for GBV victims.
We realized that people are suffering in silence. For example, a defilement would happen, a mother would not know where to go, and cases at times were just handled from that level. But currently, out of the sub-county clusters, we have continued to do sensitization to the communities with the support, of course, of our partners in the GBV field or the gender field. Yeah. They've really supported us in keeping on sensitizing the community on the need to report, on the need to preserve evidence, on the need not to be silent about anything that is happening as far as GBV is concerned.
Midrift, in partnership with Nakuru County Government, Department of Gender and other stakeholders, took part in the formulation of the Nakuru County Gender and Development Policy, which inspired the Nakuru County Gender and Development Bill.
So currently we are at the validation process stage, whereby we first we have the draft. We've had 2 drafts so far. So the 3rd draft is whereby we're going to involve the key stakeholders. Okay. So we have 3 validation processes or stages, whereby we're involving the public. Okay. The 2nd stage where we're involving the county assembly. Okay. The 3rd stage where we're involving the technical personnel, that is from the 10 departments of the county government. So we go with them through the document. They give us the ideas. Then we fine-tune it to ensure that we capture the interests and the concerns of everyone. Yeah.
Midrift has also been offering community-based mental health interventions mainly for GBV survivors within Nakuru County in the rehabilitation program.
For the last 3 years, since 2018, we have been working on this program, trying to ensure that we are providing mental health and psychosocial support at the community level within Karagita, in Naivasha, Bondeni, and Nakuru West, that is in Roa and Kaptembo area. Why the mental health psychosocial support is because these services were missing when we started the project. We did a baseline survey and established that women mostly who have undergone gender-based violence do not access these services, either at the level 4 services or any other place, and that the services were inaccessible. What we did, we decided to engage the CHVs, that is the community health volunteers, to provide the low-intent psychological intervention to the families, to the households, so that as they do their normal CHV duties, once they come across the women or the survivors of gender-based violence, they could be able to either provide the PM Plus intervention or services to them, or even refer them for specialized services to other service providers within the county.